Hello, my name is Matt Shear with PMA Practice Transitions. I assist dental professionals in selling and buying practices in the state of Ohio and Western PA. My colleague is?
I'm Joe Gordon. I do the same thing, but I do it in the fantastic state of Indiana and in northern Kentucky.
That northern Kentucky's got to be great, huh?
Northern Kentucky is wonderful as long as Churchill Downs is open.
That's right. So we're going to talk a little bit about a topic that you and I think probably get asked 99% of the time.
Yes, and I'm going to ask Matt the question so he can answer it and we can all learn from his knowledge.
Okay, ask away, Joe.
Matt.
Yes, Joe.
How long is it going to take you to transition my dental practice?
That's a great question, Joe. God, I wish I had the answer to that question.
I mean, is it going to be a month or two?
Sure.
Is it?
Yeah, it's going to be all of that. But in all seriousness, we get asked this question quite often, right? Quite often. And honestly, my simple answer is, I don't know. We don't know. Nobody knows. We have an idea sometimes on how fast we think a practice will sell based on what type of practice it is, where it's located, whether it's in a metropolitan, major metropolitan area versus a rural area. Excuse me, what type of dentistry is being done in the practice. Size of the practice, a lot of times.
Size of the practice is a huge factor.
Yeah.
Huge
factor. Whether you're doing $300,000 in revenue or $1 million in revenue, it's interesting because smaller practices are tougher to sell, and larger practices are tougher to sell.
There's a sweet spot in there.
There is a sweet spot in there.
And once you get over a certain size, and I always was telling my clients when I was in the accounting world that if you exceed a certain amount, it's going to be harder to sell your practice. And the percentage of the sales price compared to your gross revenue is going to be a lower percentage.
Correct.
Like anything else, we have a shorter sell cycle with the more population of buyers we have. Obviously, in rural areas, that can be a challenge some days, depending upon where it's at. Or conversely, it can be easy if you have someone who wants to come back to their hometown.
Absolutely.
It may happen tomorrow, but it may happen in 3 years. The same thing in urban practices. We can have practice, A and B across the street from each other, and one of them may sell quickly and one of them may not. It depends on, again, a lot of the factors Matt talked about is what kind of dentistry does it do? What's their patient population like? What is our situation with our physical facility? I had a practice that needed to sell, and they were very optimistic when they started this practice, and they signed a lease that was per square foot one of the highest lease rates I've ever seen. Well, unfortunately, to get the practice you inherited the lease,
Right.
and it took a special person to come in to want to pay that kind of rent.
Sure.
That kind of rent. So it all depends. It can also depend on the seller. We've run into situations where sellers are particular about who buys their practice. They're very protective of their patients. They've spent all these years with them, and they want a particular type of person to come in and service them.
Yeah.
Like they did. On the other hand, if we have a seller who says, I want to toss the keys on the counter, walk out the door, and I'm moving to Timbuktu, let's go.
Right.
Let's go. And then we have a lot more options on who to sell it to than we would have practiced that needs something different.
Yeah, and I think we touched on keeping options open and who you could sell to. So, if you say there's no way I'm selling to a group practice or an organization, then that's fine. That's okay. Maybe it takes a little bit longer. Maybe it doesn't.
Right.
But
exactly.
I think the key is that if you're working with a transition company and they tell you a specific time frame that they'll be able to sell your practice in, truly, I think they are selling you a bag of goods, because there's just no telling. I had a practice in rural Ohio that I listed. I thought it was going to take a very long time to sell. No technology in the practice. Didn't even have computers. They were still so antiquated. And it sold in 2 months. because I found the right buyer who wanted a practice that they can make into their own and kind of evolve that practice into theirs and update it and do what they wanted with it. And now they're doing wonderful.
One of the last ones I helped transition, I told her that it was going to take 18 months, and we sold it in 17 and a half.
Yeah.
It just seemed to be the number it's going to take.
Yeah.
So don't think you can sell it tomorrow. Don't think it's going to take forever. But it may take a considerable period of time.
I do tell all my selling dentists that your practice will sell. The thing we don't know is when.
Right.
So just keep that in mind when you're thinking and contemplating about potentially selling your practice, especially if you have a health issue and you need to sell quickly, or you've got some health issues and you don't know if they're going to be prolonged. Definitely, do it sooner than later.
Yeah.
So,
no doubt.
With that, we'll wrap up, and we appreciate you joining our segment. And if you liked it, please give us the thumbs up and certainly share it with your colleagues and friends.